All right, let's get started. So I want to welcome everybody back for this third session of this workshop series on AI and health professions education. I'm Carol Tucker, associated with the American Council of Academic Physical Therapy. I also serve as the Associate Dean of Research and Chair in the School of Health Professions at University of Texas Medical Branch. I'm chair of this workshop of the planning committee that really designed this workshop series. And again, I want to really acknowledge the planning committee and the years of work they've really put into maturing this topic to the workshop stage. I think I'm just the face piece in the morning and afternoon, although I'm definitely invested in this. I also want to acknowledge the IHPE Forum for supporting the production of this workshop. So just as a reminder, a few weeks ago, we had our first session, which was really laying down some of the foundational knowledge pieces about what AI is and where it may fit within healthcare education to really understand the role of AI across all the different aspects of our health professions. And then yesterday we pivoted a little bit. We really dug deeper into some of the social, cultural, policy, legal, regulatory considerations of AI within the context of health professions education. So we've kind of answered the what and the why a little bit over the last 2 days. And today is kind of the meat of some of this. We're going to get down to the pragmatics and we're going to talk about how do we need to be covering AI and preparing us as health professionals to help leverage some of those social, cultural, political responsibility, governance of it, applications of it. So to do this, we're first going to explore some competencies for the use of AI-based tools. And again, Dr. Kim Lomas will facilitate discussions on this topic. I want to remind the audience that we are going to be, again, being used the question and answer. So please feel free, if you're not present in person, to leverage those questions and answer, and the full bios are in the packet agenda of the speaker. So I'm going to turn it over to Kim.
Thanks, Carol. Well, I agree. Hopefully our conversations yesterday convinced most that we need to do something around this. And so now the question is, how do we move forward? What should training in AI entail for our health professionals? And so I'm excited to introduce my friend and colleague who has published a study asking exactly that question. Bonnie Miller is the former Senior Associate Dean for Health Sciences Education at Vanderbilt University School of Medicine and Executive Vice President for Educational Affairs at Vanderbilt University Medical Center. She will share her work in exploring emerging competency models for artificial intelligence across health professions. And again, I do remind you, please put your comments and questions in the chat because we'll have an opportunity for some discussion after she presents. Thanks, Bonnie.